Hi, I'm Dr. Priya Prem, consultant dermatologist and dermatosurgeon practicing in Bangalore. So today we'll discuss about what, why is it caused, and what are the treatment options available. Warts are viral infection which will spread from one person to another person through contact. The contact can be just through like the regular like when you're walking around profession, or it usually spreads among the family members and the relate and the friends. The warts are caused by the viral infection, the virus called as human papilloma virus. So this presents as the brownish or grayish black small lesions which can occur over the face, scalp, anywhere in the body, like in the hands, like in the sole. Generally, people get confused for the warts which is there. So people confuse on the face, which are like a small skin tags as a wart. When the wart present over the feet, so people confuse it as a corn. So generally they tend to neglect it. So better not to be neglected. So warts generally when it was on the scalp, it's like a small pimple, or on the face which is a brownish black. So these are something which has to be the major concern. So there were various treatment options which are available. Why is the treatment necessary? So this can spread from person to person, or when you just leave it on your skin, it can spread it over the surrounding skin itself. So it is important to treat. So the best modality is by doing any procedure like a radio frequency. It also depends on the site size also. So when it is on the like a single lesion or on the face, generally radio frequency works very well, which is a very simple procedure. So another procedure where it is on the palms or soles where there is like the lesion which is little wider, we can do a cryotherapy or procedures like an intralesional bleomycin or the MMR vaccine or the BCG and the vitamin D injections. These help in the prevention and reducing the wart. The some people who are finding difficult to get the procedure done, so where they don't have the medical access and all, so we can start on something like an application therapy. Though it will be helping them, it is like a slow line of treatment. So but better if the procedure done and has to be removed at one go. In some patients, what tend to be recurrent. In those patients, we can start them on something like to boost the immunity. We can start them on oral medications and something to reduce the frequency of coming and the prevention. So we can start them on oral isotretinoin or the application retinoin based on the site and the requirement. And in some patients, even though multiple modality of treatment is done, sometimes the wart recur. So we can do something like an auto inoculation where we take the virus particle and we process it and place it under the skin. So that will act as like an immuno booster. There are HPV virus like the vaccination which are available, so which is administered and we are finding better results where the recurrences have reduced significantly. And the main general counseling, what I would suggest most of the patients who have wart is whenever you find a wart, do not touch. Second thing, address it immediately, consult to a nearby dermatologist and get it treated. Generally, people tend to delay or postpone. The more you delay, the more chances of spreading. And next thing is when the warts are seen on the hair bearing areas like or the beard area or the private areas and all, generally avoid shaving the area. Better use a hair trimmer. That would be a better to avoid the spread. As wart is a viral infection, generally it has no correlation with a diet. It is most common to happen in the school going kids and generally people with who goes to the barber shop for the haircut or the shaving and all. So it tends to spread a little more faster. So the taking care of the hygiene helps in most of the time to prevent it and prevent the recurrence. As what is a viral infection, it is not depending on a gender. It doesn't matter which age, it can affect any individual. But generally more commoner in children and people who are compromised with their immunity. So it has to be treated immediately. As most patients try to do some home remedies by applying a soda or applying some corn cap to the warts, so better avoid that and consult your dermatologist first. So better it has to be treated than trying this and let it increase or leave the area with scarring.